The new SARS-like coronavirus, SARS, what is this virus? Is there a reason for concern before the Hajj season? The world is still waiting for the truth about the virus. In the past week, 3 cases were discovered in the Kingdom of Saudi Arabia, Qatar and Britain for acute pneumonia, which turned out to be caused by infection with a new type of virus known as corona from the family of viruses that cause SARS, which led nearly 10 years ago to the death of 800 people around the world. 2 of the 3 cases died to keep the medical community with many questions about the severity of the infection, especially before the Hajj season in the Holy Land in the Kingdom of Saudi Arabia, and this fear comes especially since the injured people from Qatar and Britain came from a trip in Saudi Arabia to perform Umrah. The Saudi Ministry of Health issued a statement 7 days after isolating the virus in the laboratory, stating the reasons for discovering the virus and cases in the kingdom and abroad, and the ministry explained in its statement that the coronavirus is known and most of those infected with it recover after providing a simple and supportive treatment without complications and in very rare cases. A rare type of this virus, which affects respiratory and kidney complications and may lead to death, especially for the elderly, those with chronic heart and chest diseases, and immune deficiency. Based on the World Health Organization data on the subject, the ministry assured citizens and expatriates of the health situation in the kingdom and urged all to receive all flu and fever vaccinations, and it also called on those coming for Hajj and Umrah to adhere to health instructions during the Hajj season, and that, sterilizing hands continuously, wearing masks to prevent the transmission of diseases, especially for pilgrims who suffer from chronic diseases while on the move in places of great congestion. About the virus, corona is called the coronavirus or the human coronavirus. These viruses were called corona because they appear in a microscope in the form of a crown. Like this family of viruses causes mild to moderate respiratory infections in humans. It also causes diseases of the respiratory, nervous and digestive systems of animals. It is worth noting that other coronavirus strains belong to the SARS virus, and the coronaviruses form a large group that includes the common cold and severe acute respiratory infection (SARS) viruses. As this is a new type of coronavirus, the World Health Organization is currently collecting more information to determine the expected effects of the discovery of these 2 conditions on public health. The disease is transmitted through contamination of hands, respiratory droplets, and direct contact with the patient's fluids and secretions and small air particles, as the virus enters through the membranes of the nose, throat, pharynx and trachea, yet health experts say that this virus is not highly contagious. We have seen a greater prevalence of infection, as these cases were the only ones recorded in 3 months. The most important symptoms of infection with coronaviruses are ordinary fever, inflammation of the nose with a runny nose, sneezing and coughing, a headache, sore throat, muscle pain. Fortunately, coronaviruses are very fragile. They may only survive for a day and can be easily destroyed by sterilizers and regular cleaning agents. As the disease lasts for several days, sometimes 2 weeks. The patient's condition also improves and he recovers automatically without any treatment. To summarize the current situation, we say, the detected cases are few and there is no evidence of widespread infection. Flu vaccination is recommended. Symptoms are similar to the symptoms of the common flu. Adherence to prevention instructions, sterilizing hands constantly, wearing masks to prevent disease transmission, especially for pilgrims who suffer from chronic diseases while on the move in places of great crowding.